Hi guys, welcome to Learning Desire. So today we are going to talk about newborn care. So we all know that what is newborn care uh, and why we provided it has some goals. The first goal is to establish, maintain and support respiration, to provide warmth and prevent hypothermia, to prevent from infection, to provide safety and prevent injury, to identify actual or potential problems that may require immediate action. So these are the main goals. That is why we perform newborn care. Management of newborn is divided into two categories. First one is the at birth and second one is in nursery. So first of all, we will talk about the management which we do at birth. So it is includes establishment of respiration, initiation of cry, and maintain position of the newborn, upgar scoring, care of eyes, and care of cord, vitamin K administration, initiation of breastfeeding. So in these all aspects, there are important key points which we cover in this. First one is the establishment of respiration. Why we perform it? We perform it because so that we can maintain the breathing pattern of newborn efficiently. So what we're gonna do in this, first of all, we have to clear newborn's airway immediately after birth so that his breathing pattern can be uh, can develop, or we can say that a newborn can breathe efficiently. And second one is to remove mucus and other particles which may cause obstacle or obstruction in the nose. That is why we are performing. Next one is immediately after that we have to immediately wipe out the mouth and nose. So these are the main key points that we cover in establishment of respiration. After that, there is an initiation of cry. So we all know that crying is considered as a good sign, because if the cry is good, then it means that the breathing in newborn is the main point that we have to cover, or we have to give a focus on, is that never slap the buttocks. Never slap the buttocks. We should just rub the sole of the feet to stimulate cry. This is the most important key point. And next one is that always stimulate the newborn to cry after the secretion is removed. So this is all under an initiation of cry. Next one is the maintain position of the newborn. Now we why we provide positioning to the newborn? We provide because so that we can facilitate the postural drainage of the newborn. And in this, what we're gonna do is we will provide a support to the newborn with a small pillow, or we can also roll the towel at the back. Next one is the upgar scoring. This is also the most important, and it is done immediately after the birth at 1 minute and 5 minutes. And next one is what, that is care of cord. Now uh, after the birth, we have to clamp and cut the cord of the newborn within 30 seconds. And nothing should be applied on the cord. And we know that it lift gradually. It has a natural process, so it dry and fall naturally. And this process mainly includes within 7 to 10 days, and it leaves a granulating area which heals in 7 to 10 days. And we have to make sure that the cord doesn't get wet. And also advise the mother that she should fold the diaper below, so that she can prevent it from getting wet. And there is a main point, that is what, if there is any discharge, bleeding, infection, or any foul odor, bleeding, inflammation, and it is not following off within 7 to 10 days, then we have to report the physician, right? Next one is the vitamin K administration. Now we all know that what is the function of vitamin K, as it is important for clotting factors. So that is why we are administering vitamin K, that is 0.5 ml or 1 mg IM on vastus lateralis side, or lateral interior thigh, so that we can prevent a newborn from bleeding. Next one is the initiation of breastfeeding. We have to initiate the breastfeeding within half an hour in case of normal delivery, and in case of cesarean section we have to initiate breastfeeding within 1 hour. Second one is the management of newborn in nursery. First one is the admission in nursery. So why we gonna admit the newborn in nursery? uh, it includes some indications, like if the baby is having respiratory distress, and or a paler color is present, or a cyanosis is present, or malformation present, and if the baby is of premature birth, so then we gonna admit the newborn. And also if the baby is requiring oxygen therapy, then we gonna admit the baby to the nursery. Next one is a routine nursery care. So in routine nursery care, it is a it's like a assess the weight, front to occipital circumference, and we should also assess the length, and then we gonna what to do, we gonna record that. After that, we have to in this we have to capture newborn under a neutral thermal condition, and we have to provide a kangaroo mother care. So next one is daily observation and care. In this, it includes all the aspects like grooming in baby bath, umbilical cord care, routine medications, eye care, immunization and vaccination, and screening of the newborn, assessment of vital signs, feeding, discharge, follow up. Next one is the infant growth assessment. In this, we have to do a several measurement of weight, length, head circumference, and chest circumference. So this is all about the management of newborn. I hope you will get understand about this whole topic. So please, if you like this, then like, subscribe my channel. Thank you.